That's the psychological toll that I'm talking about, because we've never, in at least in our lifetime, experienced anything like this. Um, and there's a fear factor too, because you're right. Even if you have to go out, you don't know if going out is exposing you, and so it's this constant fear of what if, what if, what if, what if. And
Right.
so I think the disorientation is real. Being it's unnatural, first of all, and so it when you talked about like being at home, the relationship piece is one piece, but hearing people say that they're what's called COVID weight. So you're sitting at home, you're not going out, you're not really doing anything, and you're gaining pounds. Well, that's going to contribute to the health factor. So that's what I'm saying. This thing is going to go on.
Yeah.
The impact is going to go on for years to come. So you're sitting there, you're angry, you're eating, you're lashing out at people. That can't be a healthy environment that's being created in our home. So
Right.
I think that we want it to be over, but it's not going to be over, and soon, just because of the way that we started out, it's just going. And I predicted that it's going to go for the most of 2021. So what that means for us is buckling down, getting your head right, that whatever you got to do to survive and to find some joy. So this is just not surviving. We got to find some joy in this thing, because otherwise the psychological toll is going to be much greater. So so we're tired of Zooms. We're just tired of all of it. We want to go out, we want to dance, we want to go to the movies, we want to go out to eat. That stuff there's been a damper put on there. And so what do we need to do? And some people are finding, some light at the end of the tunnel, because they've tried to create spaces even in their homes that's going to be affirming and nurturing. So you talked about people who hadn't normally been together, but some people are using that space to really begin to learn who their children are, what their likes and dislikes are, what their strengths are. And they had never had that opportunity before, because, as you said, everybody's in transit. We just moving. And you have glimpses of your kids as they come in and going. But do you really know them? And some of this means you really getting to know who's in the house with you.
Yeah, that's real. Back to the death toll disproportionately of African Americans, and you mentioned making the case for murder. Dr. Brittany Cooper has popularized the term. She isn't the originator of the term, but she's been talking more and more about the term. I had her on the show, necropolitics, the politics of who lives and who dies. And you can't help but wonder, with the way this thing has gone down, whether Trump and the governors who are his minions figured, well, some people are going to die, some white folks even going to die, but it's going to disproportionately affect African Americans who don't vote for us. You have to kind of wonder if that wasn't in the calculus, don't you?
I definitely have heard that being talked about, because for example, in St. Louis, the first 12 people who died of COVID were Black. The first one who died was a Black woman. So it was clear to us very early on that we were going to be the victims of this, and we better do something quick. So we in St. Louis, and probably again other places, began to pull together folks, healthcare professionals, community people, to say, okay, forget about the health department. They don't have a clue. Those of us who are close to these communities know what we need to do. And it is like really a campaign. You got to go in there and not just throw up some billboards or flash some stuff on TV. You got to go talk to people. So we had teams of people going into communities, especially the more vulnerable communities, to really talk about, COVID and what it was going to mean. But meanwhile, our death toll was going up. But I think it's stabilized some as much as it can. But of course, we were disproportionately represented in nursing homes and in prisons and jails. And so we couldn't get to either one of those populations in ways that we wanted to. So, I remember some months ago, we really had to do a campaign to get testing done in the city and county jails, It was going to be harder to do that in the prisons just because you got to go travel to those rural areas. But you got the jails right here. Why come we can't be testing them? And there were health entities that said we would do it for free, but for whatever reason, the officials didn't let it happen. So we had to put pressure on them for that. So it's just been like a fight every step of the way to get what we need, and that part is fatiguing as well. I remember when we did the stay at home for work, and I told staff, I said, let's make a list of the things that we didn't get a chance to do because we've been so busy. Now we're going to have all this time. I underestimated it because there was no time. Because then the fight was making sure that we get resources to testing, and it was not a minute to spare. It was no extra time. So and see, even now, Mark, people think that okay, if you have it, if you get it and you survive, that's a good thing. But now we're hearing about the long haulers syndrome. This stuff doesn't go away. And so what is going to be the psychological and financial toll of having this COVID be with us for 10, 20, 30 years? So it's more than the notion to even wrap your head around it.
It is. And so now, obviously, and you address this in your article as well, the $1 million question is whether or not African Americans should take this vaccine. So I'm gonna put you on the spot. Where are you, Jamala? Are you and your family? What are you and your family members thinking? You all going to do this?
I personally am having to wait and see what the vaccine actually does. At the time that I wrote the article, I had said I don't know anybody that I'm coming in contact with that says they're going to take it. Well, since then, I came across one young Black man who said he's going to take it because he doesn't see the harm that it's going to do, and he understands about the history of our people with the medical industrial complex. His thing was like, I gotta be safe for my family and my community, and I get that. And so I think as it rolls out and people see what's happening and see who's taking it, that it might change. But at this point, I think it was 40% of Black people who said that they would take it. That's not enough because all the experts say you gotta at least have 70% of the population, the population, taking it in order to make everybody safe. And so, so the way that it was fast tracked is of concern because we know when these the pharmaceuticals do their thing, they cut corners, they're trying to make money, they're willing to do whatever they can to get it on the market and deal with the consequences later. So I'm not that comfortable. And I know that people like me and you have to have a view on it, and at some point may even have to support the vaccine and maybe even take it. I had to really do that even with the testing. I did a press conference where I actually, got the testing done so people could see that, okay, Jamala's taking it, she's still alive, and we need to do that. So I know that there's a lot of pressure on me to figure out what my view is going to be in the next few weeks. But right now I'm very skeptical, Mark, very skeptical. And because I know they didn't do the clinical trials. And this is the thing I was telling this young man. He said, well, they actually have given the vaccine to many more people than they would normally. I said, yeah, the reason the trials last so long is because you got to study the impact of that vaccination over time. And so that's not been done. So that part of it, we've been cut off from. We don't know. So it's going to be whoever. I know they did the sister in New York, who was an ICU worker, got hers first up in New York. So, maybe we'll look and see what what happens to her and other people that are taking it to make sure that it's safe. And I know our 3 ex-presidents said that they would take it, publicly to alleviate people's fears. But I think, it's not an unfounded fear, Mark, and you know this. This stuff is not unfounded. We don't have a good relationship with the medical industrial complex, and our history has been wrought with samples of it. Not even just the Tuskegee experience, which is probably the one that looms over us more than most. But there's other stuff, even modern day, of how we are not getting the health care that we need, even though we have insurance, even though we have all of the things that our white counterparts have, and we still don't get it. And that's why that health disparity racially is still a gulf. And why is that in 2020? I mean, yeah, 2020. So we got some hurdles that got exacerbated through COVID that were already there, and they're proven to be lethal. And so I think we need to, again, start looking at where the policies are, where we need to have some pressure put. And I think that stimulus package is one of them. And looking at how this vaccine is rolling out, who gets it, what is it doing? So, for example, Mark, what if something happens that we start to see some negativity with that vaccine, like in a month, because there'll be some people taking it? What then? Are they going to halt that and then go back to the? So I'm in a wait and see, because I just don't trust the system.